permission to record on this?
All right, folks, I believe we're ready to go. Doctors, if you're ready, please proceed.
Thanks. Good afternoon, everyone. I'm Brent Roosen, Chief Provincial Public Health Officer for Manitoba. I want to start with an update on rapid antigen tests. Over the last few weeks, we received additional rapid antigen tests. This means we're now able to put plans in place to improve access for more Manitobans. We know that many Manitobans have asked in the past if they could have a few tests at home before they're sick, so that they can use if they do develop symptoms. So this wasn't really possible before due to supply. But now, as we've received more supply, we are going to make more tests available to Manitobans. So now people who don't have symptoms can pick up a rapid test kit at provincial testing locations. This will allow Manitobans to have some on hand if you or someone in your home does develop symptoms. So the supply is better now. So people don't need to rush out to pick these up today or tomorrow. It's something you can add to your agenda next time you're running errands or near one of the testing locations. So we're working with community partners as well to distribute these rapid antigen tests. Our focus is to reduce any potential barriers to individuals and to families accessing these tests. The United Way Winnipeg has recently received a shipment of more than 16,000 rapid tests. And so those are going to be distributed to social services, senior and newcomer service organizations in the coming days. As additional plans are put in place to improve this access, we're going to share that in the bulletins or in or online. Yesterday, Manitoba moved to yellow or caution on the PRS, the pandemic response system. So this is an important transitional phase for our province and reflects that the COVID situation is stabilizing and then improving in Manitoba at this point. Data and modeling were shared last week following the announcement of the public health orders that showed a number of the factors improving, those factors that we consider important to follow in public health. As part of that shift to the yellow level, we removed occupancy limits for most spaces, including private residences, and made some changes to self-isolation requirements as well. So if you are sick or test positive for COVID, stay home and follow the rules for isolation. This gives you time to recover and reduces the chances that you could transmit the infection to others. Close contacts, such as household members, should self-monitor for symptoms and are not routinely required to self-isolate except where specifically advised by public health in high-risk situations such as outbreaks or in healthcare facilities. If you live in a First Nation community, please check with the rules in your community and ensure you follow those appropriately. Anyone exposed to COVID-19 should self-monitor for symptoms very closely for 14 days following exposure and isolate immediately if any symptoms develop. Should always be cautious during your self-monitoring period. Avoid any non-essential visits to high-risk settings or non-essential contact with individuals who are at high risk of severe disease. As you know, other changes are planned for the weeks ahead as proof of vaccination requirements for places like restaurants and other public venues will no longer be required by public health. Mask requirements are set to be lifted on March 15th. For some Manitobans, as we've seen at all stages of this pandemic, these restrictions, the lifting of these restrictions can't come soon enough, but for others, they feel they're being lifted too quickly. And so as we transition away from public health orders back into public health messaging, I'm asking all Manitobans to continue to respect each other and treat each other with kindness. This has been a difficult 2 years for pretty much all Manitobans. This is going to be a difficult transition phase. And of course, we're not done with COVID. So we're going to have to continue to work together to protect Manitoba. So there's going to be people who continue to wear masks in public settings, and some businesses may require masks going forward as we navigate through this transition phase. Manitobans should expect that in some settings, especially in healthcare facilities, personal care homes, some protective measures may stay in place to protect those people who are vulnerable to infection. So as these changes come into effect, many Manitobans might also have questions about what might happen next as we emerge from the Omicron wave. Our approach in Manitoba mirrors a statement issued earlier from my colleagues at the Council of Chief Medical Officers Health. We're able to reduce restrictions at this point due to Manitoba's excellent vaccine rates. We are looking at a longer term way to manage COVID-19. So it's very likely that we'll see more COVID-19 in Manitoba, more waves and more variants. But we have many tools in place to protect ourselves moving forward, vaccines being the most important one. So in the coming weeks, there's still a lot we can do together to prevent COVID and other respiratory illnesses. Wear your mask. Definitely now, it's still required. But in the future, indoor public places where distancing isn't easily obtained, you may want to consider continuing to wear that mask. Absolutely staying home if you're sick, washing your hands, covering your cough, managing those group sizes. And again, especially if you're at high risk for severe outcomes, if you have underlying medical conditions, or if you're in the older age group, definitely ensure your vaccines are up to date, but do manage your contacts. And remember, we have a treatment option now for COVID-19. The challenge with it is it has to be administered within 5 days of symptom onset. So again, we're seeing a lot of people test positive who would have been eligible for treatment, a very beneficial treatment, but they were presenting too late in their disease course. So they weren't eligible to receive this medication. It wouldn't be effective. So please, especially if you're high risk of severe outcomes, get tested early as soon as mild symptoms develop, because you may be eligible for a very effective treatment that helps prevent those severe outcomes, such as hospitalization and ICU admission. So thank you to all Manitobans, and I'm going to pass things over to Dr. Reimer.
Thank you, Dr. Roussin. Good afternoon. I'm Dr. Joss Reimer, medical lead on the province's vaccine task force. As we've heard from Dr. Roussin, we're seeing a stabilization here in Manitoba. Vaccination has played a tremendous role in that happening. We know that the vast majority of Manitobans united, rolled up their sleeves to protect themselves, protect each other, and our communities. The decision to vaccinate against COVID-19 has so far been made by over 1 million Manitobans. Together, we have chosen to heed the science, to seek to understand the safety and effectiveness of the vaccine and to take the step to be immunized. We will never fully know, and thank goodness for that, what things would have looked like in Manitoba if so many of you hadn't been vaccinated. Without the vaccines, we would not have been able to keep pace with the demands on our healthcare system. Our hospitals and ICUs would have been so far beyond capacity that we would have been looking for other places for Manitobans to receive care. Without the vaccines, our schools would probably have needed to continue with remote learning for a much longer period of time. And without the vaccines, more businesses would have been forced to close, and the pressures on every sector in our communities would have been felt harder, and the impacts more lasting and more difficult. So I never want anyone in Manitoba to underestimate the power of your decision to protect yourselves and your community over the past 2 years of this pandemic. I hope that you appreciate or come to appreciate as much as I do the gift that science has brought us with this vaccine and the ability of new advancements in medical research to save lives and protect us all. All of this is to say, I am incredibly proud of Manitobans. I'm proud of the teams working across the province to protect us all through immunization. And our work to continue the vaccine campaign does not end just because we're loosening restrictions. The work continues because we still need to reach those Manitobans who have not made the decision to be vaccinated. To that end, I want to highlight 3 new studies that apply to people who were infected with Omicron. The first was a study in mice. Mice were infected with either the original strain, with Delta, or with Omicron. And the scientists took their blood to see how well it could neutralize 5 different variants of the virus, including Omicron. What they found was that when the mice were infected with Omicron, they had a weaker immune response, and their blood was only able to neutralize the Omicron variant, but not any of the other variants. The mice infected with Delta did better, and their blood could neutralize many, but not all of the different variants. So the worry here is that it could mean that people infected with Omicron will not develop any cross protection against future variants. And even that people with a Delta infection may not be protected against a future variant. By itself, I wouldn't put much stock into a study in mice. These types of studies are good for generating hypotheses or new ideas, but they can't confirm what's happening in humans. So if it wasn't for other similar studies in humans, I would simply have noted that this study is interesting, but not shared it with you today. But this study had a second half where the researchers looked at the blood of people infected with Delta to see if it could neutralize the different variants. In humans, they found that the blood of somebody with a previous Delta infection could only neutralize 2 of the 5 variants included in the study. But if that person was vaccinated, their blood could neutralize all 5 variants. So the researchers in that study concluded that infection with Omicron in unvaccinated individuals may not produce an immune response that protects against other variants. In vaccinated people, the addition of an Omicron infection may be effective at producing antibodies. So a study from Austria found almost the exact same results. This one was done looking at a group of people who were infected with Omicron. Some of these people who had an Omicron infection had previously been vaccinated. Some had had a history of infection before Omicron, and some had neither. They found that in people who either had been vaccinated or had had a previous infection, had high levels of antibodies produced against all of the variants. But for unvaccinated people, where Omicron was their first infection, they had only a low number of antibodies against Omicron, and they tested negative for antibodies against all other variants. So these researchers concluded that unvaccinated individuals infected with Omicron only may not be protected well against infection with any other non-Omicron variant, and should subsequently be vaccinated to ensure that they have protection. The third study was from South Africa, where again, they found that in unvaccinated people, an Omicron infection did not produce a strong immune response against any other variant. So what does all of this tell us? It tells us that if you've had 2 COVID infections, or you've had a vaccine plus a breakthrough infection, your body does make a lot of antibodies against all the variants that we have seen so far. But if you're unvaccinated and you were infected with Omicron, you might be protected against Omicron in the future, but you won't be protected against other variants. For vaccinated or doubly infected folks, we don't know how long these antibodies will last, and we don't know how well they'll work in the real world against the existing variants or any future variant. This is why we still recommend that you get your next dose to give yourself the best possible chance to fight the next variant that comes, even if you did have an infection. But what we do know is that if you never developed antibodies in the first place, which in all 3 of these studies was the case for unvaccinated people infected with Omicron, you are still at risk. Now, this is unfortunate. We certainly had hoped that an Omicron infection, because there were so many of them, would help prevent further infection in people going forward. And what we're seeing instead is that for people who have never had any vaccine or previous infection before Omicron, it's still critical for them to get vaccinated. And so the task force continues to work to reach those who are disproportionately affected by the risks of COVID-19. The work continues to urge Manitobans who have not yet received their 3rd dose booster and parents who have not yet vaccinated their children to do so. If you've been recently infected with Omicron, you should still get your next dose after a few months. The school-based vaccine clinics are continuing to open their doors to members of the public after school hours. Children are being vaccinated in dozens of Manitoba schools right now. And overall, the school-based campaign has included hundreds of schools. There are still many community clinics operating province-wide, so I encourage you to look to see in your community what's available. Pharmacies and physician offices will also continue to offer the vaccine. And the provincial vaccine clinics still have their doors open for appointments. And the RBC Centre in Winnipeg, for example, is still open for walk-ins. So even though the majority of Manitobans are already well protected, we are not finished yet. I want to ask all of you to please reach out to friends and family members who have not yet been vaccinated against COVID-19. Find out how you can help them to make that appointment and get out the door to be vaccinated. Just because we're loosening restrictions does not mean that COVID-19 doesn't still pose a risk. It does. But it's a risk that we are working together to learn how to manage. And we'll continue to do that with vaccines being our best tool. So on behalf of the province's Vaccine Implementation Task Force, I want to thank all of you for being part of this incredible campaign. We've never seen anything like this in the history of our province. And so thank you to everyone who has taken part and doing your bit to protect our province. We will now take questions.
Thank you, doctors. A reminder to our reporters on this Zoom session, you will have one preliminary and one follow-up question. Up first this afternoon from the Canadian Press, Kelly.
Hi. So you mentioned just now that people should continue or consider continuing wearing the masks even when it's no longer mandated. So I wanted to ask if before the decision was made to remove the mask mandate in a couple weeks, I can't remember the exact date, did you recommend that the mask mandate be removed?
So like I said, in the past, our recommendations, public health recommendations come at many times in many forms. So with this path forward, this is, part of public health's, approach to loosening restrictions over time. Again, we're moving from public health orders to public health recommendations. There's all sorts of public health recommendations that are given to the public that significantly reduce their risk of all sorts of illnesses. And so this is the path forward where we're going to continue to make those recommendations. And certainly mask use, indoor public settings where distancing isn't possible, is certainly something that people can consider. And again, people who are at high risk of severe outcomes need to take extra cautions, or at least consider their level of risk tolerance moving forward.
And for Dr. Reimer, we're looking at on the vaccine dashboard, 42.8% of people in Manitoba with 3 doses. Is this about where we want to see 3 doses coming? If you consider the time and having children included, or are we lagging behind in the 3rd dose in what you would expect to see?
We still have a ways to go with the 3rd dose. In particular, it's really important for people over the age of 50 to get their 3rd dose, as well as anybody of any age if they have any high risk factors that may contribute to them becoming severely ill if they did contract another infection. So, I'm really happy to see the numbers, but at the same time, recognize that there are many people who have not yet gotten that 3rd dose and could be putting themselves at risk of ending up in the hospital if they were infected because of a health condition they have, something like diabetes, for example, or because of their age, just because they're over the age of 50. So we still really want Manitobans to come and get as protected as possible so that we can help protect our healthcare system, but more importantly, so that each individual doesn't have to go through that severe illness that can be quite devastating on yourself and on your family.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I wanted to ask about, some other countries who lifted restrictions earlier than we are here have already seen, hospitalizations and ICU numbers, death rates start to increase. So what would happen here if we do see another increase? And would you then go from recommendations back to restrictions? What sort of planning is being done?
Yeah, and so, we're not going to deal necessarily with the hypotheticals moving forward, but certainly we have a number of tools in our toolbox to address things. Just one of them is the use of public health orders that we have now started the loosening of at an appropriate time. So moving forward, if there ever is a need, then it's something that would be considered. But we have very high vaccine rates that are climbing daily. We need Manitobans to continue to get whatever dose they're eligible for. And then of course, the things like the surveillance of infection, the impacts on the healthcare system, we're always going to be closely monitoring that and make recommendations based on what we're seeing.
Speaking of surveillance, we've heard, the BA2 version of Omicron could potentially have, movement toward another wave. Have we seen any of the BA2 here in Manitoba, and any evidence that would spread quickly?
We have seen cases here. We haven't seen evidence of it quickly becoming a dominant strain here. From what we know of that strain, we're seeing is that it is likely more infectious than Omicron, but we're not seeing any significant signals suggesting it's more severe. So at this point, we're continuing to follow that, but it hasn't changed our approach.
From City News, Mike.
Good afternoon, Dr. Roussin and Dr. Reimer. My first question, in speaking with infectious disease experts, at least the ones I've spoken to, it seems the general consensus is that the vaccine mandate or the vaccine immunization cards that there's logic in eliminating those, but the mask mandate, they just either say it's too early or there's just no rhyme or reason to do this. So can you make it make sense to those infectious disease experts? Can you make it make sense to the Manitobans I've spoke to who say they don't understand why the piece of defense against the vector in which the virus spreads is going away with these restrictions? Why can't the mask mandate stay?
Well, masks can stay. Manitobans can choose to wear a mask if they feel that it makes them comfortable and reduces their risk, and we still recommend it in high risk settings. So like I was saying, there's many public health recommendations that significantly benefit individuals' health and lower their risk of numerous illnesses. They're just not mandated under a public health order, right? And so this is something that we've had to do in extreme circumstances now for the better part of 2 years. But we are moving back to public health recommendations, like on so many other things that protect people's health. But they do have that ability to assess their risk and make that choice. And masks are trending in that direction.
Thank you for that answer. So I guess I'll be more specific, like grocery stores. We all have to go to grocery stores to get our food. Even with a mask mandate, there were some people who would enter grocery stores. I've seen this myself with a mask on. Once they're in the aisles, they pull their mask down. So even with a mandate to need to wear masks in a public space, there are some people who still would flout that rule. So if the restriction is going away and now it is just a recommendation, are we not worried this gives a green light to people to ditch masks entirely and only a select few will continue wearing them, but COVID doesn't pick and choose who it infects, who it leaves the vector of their respiratory system from? So isn't this just a gamble at this point?
Well, I mean, this is not unlike any other public health recommendation. So we have all sorts of things that we talk about with the public that reduces their risk of disease, prevents diseases, but we don't mandate it. And so this is, we've gotten into this, period of extreme measures that we've really never used to this degree in the past. And so it's very challenging for people to exit from that. And we're doing so slowly and cautiously, but we are going to have to transition into a period where we have public health recommendations, no longer having public health orders in place. And like we mentioned, it's going to be a tough transition phase for many people. Like we said, some people can't come soon enough. Some people, it's moving too fast. So we just ask Manitobans to continue to do their part to protect themselves and others from COVID. And that biggest one is to get vaccinated. Get vaccinated with whatever dose you are currently eligible for.
From the Winnipeg Free Press, Katie.
Good afternoon, doctors. Why haven't we seen the province's future projections on how the lifting of restrictions is going to affect public health in Manitoba?
So we shared our data and modeling. Things like what the future looks like is really difficult to predict. The modeling that we presented, including real-time data like the sewage positivity, has all been presented. We'll continue to show that, especially if there's any significant changes with it. And so we'll keep modeling, keep looking at those indicators, but we don't have that model in place, which will tell us exactly what will look like in a month or two. From what we do have, we're trending in that right direction, and so we're moving to lift the restrictions slowly.
Well, how far into the future are you able to look based on the modeling that the province does have? I'm asking this because 2 days before you and the Premier announced that the restrictions would be lifted last week, Dr. Atwell said he didn't think there was a really good model to show how much of an impact dropping the vaccine and mask mandates would have in Manitoba. So how far into the future have you been able to look to make these projections?
Yeah, well, it depends on the further you look in the future on a model, the wider the confidence intervals are, and the less useful it is. So we certainly look 2-4 weeks into the future, and we see that downward trend. But yeah, the models don't give us a crystal ball as to what precisely we're going to see, and that's why we move in an incremental fashion. Remember, Omicron having a much shorter incubation period, and so in between these lifting of measures, which seems quick based on previous strains, we're fitting in many more incubation periods with between those 2 weeks. So we're still watching things. We'll still be modeling, and we have a number of incubation periods in between the lifting of the restrictions to base that modeling on. So as we see any significant changes, we'll certainly share that with Manitobans.
From Global News, Brittany.
Hi, good afternoon. Dr. Reimer, we've had a lot of people questioning immunity levels and how long those are lasting, whether or not they've gotten 3 doses and gotten, one of the variants, where they got the variant in comparison to that, and people who maybe weren't vaccinated and got COVID at some point. Do we know the differences in how long we're seeing immunity last with those differences on when you got COVID in comparison to also when you were vaccinated and possibly boosted?
Well, we're still really early on in the boost campaign, so it's hard to have any longer term data because there aren't very many people worldwide who have had 3 doses for a long period of time. So right now, the boost, we've seen some various signs that might hold on, or perhaps it does wane a little bit, but it's really early for us to have anything conclusive about how long you're protected after a boost. The same goes with a previous infection. We actually have a lot less data because there are far more people who are vaccinated than there are people who were infected. And so most of our strong data about protection comes from much larger, more robust studies on the vaccine compared to an infection. What I shared today is some concerning new data that shows that in those 3 studies, that people who had an Omicron infection who were not vaccinated are not developing antibodies against the other variants. And so I know that there's a lot of people who may feel that now that they've had that infection, they're protected and they don't need to worry about things anymore. But unfortunately, these studies are showing us that that's just not the case. So that's who I'm most concerned about right now, is people who are leaning on a previous Omicron infection as their only source of protection, and believing that they're protected when in fact they really do still need to get the vaccine.
Thank you. And I guess, do we have any data on previous variants when it comes to that? Obviously with Omicron and with people that are boosted, that is still quite new. But how long were we seeing immunity last, if you'd gotten those 2 shots and maybe Delta or had previously been infected with COVID? I know previously you talked about kind of a 6-month mark.
Yeah, with 2 doses, we had good information that people who are young and healthy, even at the 5-month mark, were still very well protected against severe outcomes. There was some decrease in protection against infection, but we really across the board have seen that 2 doses continues to provide great protection against severe outcomes for people who are young and healthy. So, every study that we've looked at so far has shown long-term, as long as we have, benefit against those severe outcomes. And that's why we talk more about people who are over the age of 50 or who have those health conditions, because then we did see that by the 5-month mark, there was some decrease in protection even against severe outcomes. So it is important for people who have anything that increases their risk to get that 3rd dose, because we do know that many of them, their protection has waned over time, both against infection generally and against severe outcomes. And it would be the same thing with someone who has a previous infection. If you're young and healthy, you probably have longer protection than someone who is older or unwell. But like I said, we just have so much less data looking at previous infections because there's so many fewer people who have been impacted by an infection. And when we're looking at it, we really are saying, give yourself the best chance at being protected that you can. And the best chance is with the vaccine. We have the best data showing protection. And so we don't want people to rely on a you might be protected scenario. We want people to go and get the best protection that they can.
From the Brandon Sun, Karen.
Good afternoon. And just getting back to, you were talking about long-term management. Does that also include perhaps trying to rebuild some of the healthcare system and the hospitals? Because I've heard plenty of stories from other physicians saying that this has really taken a bite out of personnel, and it's also exposed how what's been called hollowed out of the healthcare system. So what plans do you have to maybe help shore up the hospitals and the healthcare system, and also personnel that are still here?
So, one of the major reasons for requiring restrictions was to protect that healthcare system, to not overwhelm the healthcare system so that Manitobans who are in urgent need of healthcare, whether it's for COVID or not, could still receive care. And so certainly as we plan for future waves, we do need to ensure the healthcare system is strong and able to respond to that. So anything specific on those plans will be, have to be addressed to shared health. But certainly the protection of the healthcare system was one of the major drivers of the public health restrictions.
Okay, thanks. And more for the vaccines, just considering all the data we have in terms of immunity waning, just in your own professional view, do you think this is something we're going to have to maybe get immunized against every year, every 2 years, something like a flu vaccine?
Yeah, we still don't know for certain what the future holds, but I think this virus has proven that it can change, that it can adapt. And so, if I had to make an educated guess, I think we are probably looking at an annual campaign similar to the flu virus. The flu also influenza changes year to year, and so we're always adjusting the vaccines to try to match and provide the best protection that we possibly can. So it's certainly a strong possibility that we'll have to do something similar with COVID going forward. But there's always the chance that something could surprise us here and that not be the case. But that's the most likely scenario going forward.
From CJOB, Rosanna.
Hi, Dr. Roussin. Some within healthcare are calling for COVID-19 vaccine mandates to continue applying in settings where there are vulnerable Manitobans. And last week you hinted that could change. Any updates on what you're considering there?
Yeah, and so we don't have any further updates on that. We know that the plan is to lift the mandates in most settings like restaurants and public venues. When we look at those more vulnerable settings, we're still engaging with those sectors with that, so we don't have any further updates on that as of yet.
Okay, thank you. And Dr. Reimer, with the announcement that public health orders will phase out into guidelines by mid-March, how are you adjusting your vaccine campaign now that motivator will be gone, and are you concerned that it could dampen uptake?
You mean the motivator of the proof of vaccine has been in place for quite some time, and using the proof of vaccine to encourage more vaccination has likely reached not an end point. There's certainly going to be some people who are still motivated by it, but likely we've reached the majority of people where that's going to be an effective tool. So removing the proof of vaccine requirements, I don't think is going to have a major impact on uptake going forward. I think the bigger issue is that we continue to develop trust and ensure that people feel that their questions can be answered, and ensure that the vaccine is really easy to get, really accessible, because we don't want there to be any barriers for people who do come around and feel that now is a good time for them to get the vaccine.
From the Winnipeg Sun, Ryan.
Hi there. Just in terms of vaccines, should Canada or Manitoba as a whole maybe be focusing now on, not to say that the vaccination program is done here, but focusing more on getting vaccines to other parts of the world where, vaccine uptake has been a bit lower?
I mean, there's no question that many parts of the world still need more vaccine. We have a long way to go as a global community to ensure that everyone has the same protection that Canadians have been offered. We're extremely fortunate to be in Canada where the vaccines were made so widely available. The only thing that we can control here in Manitoba is what we do with the doses that we have here. And so we're working very hard to ensure that everybody has equitable access to the vaccine here. But that doesn't downplay the importance of Canada working with other countries, working with the global community to ensure that everyone is protected and that we make sure that there aren't regions of the world where the virus can continue to thrive and change and cause disease there, but also put other places at risk because of what might be happening there.
Okay, thanks. And a question for Dr. Roussin, just maybe an update on Paxlovid shipments. Are we getting more? Is there enough, you think, to handle, I guess, future waves, if at all?
So I think the important thing here is to again message that we have an effective treatment that's available. And so, at this point, we still have supply available. I don't have the details on when more supply is coming, but we do want to make sure that everyone who's eligible to receive it is aware of it and is utilizing it. So, again, for this medication to be effective, we need people to start on it within 5 days of symptom onset. And so that's where we're seeing a lot of barriers to this. Many people who are being diagnosed who are high risk are presenting later in a disease course, so they're not going to receive benefit from this. So if you're at increased risk of severe outcomes, if you're in the older age group, if you have any underlying medical conditions, even very mild symptoms, get tested very early because you may be eligible for quite a beneficial treatment to help keep you out of hospital.
From CBC Radio Canada, Anne Louise.
Hello. We have met some pharmacists today who tell us that since the declaration of Friday, some parents have already cancelled the second dose appointment of their child. What do you say to these parents? Do you think that they made a mistake?
Sorry, can you ask that question again? I'm just not sure what the situation was with the parents.
Yeah, some pharmacists tell us that some parents have already cancelled the second dose appointment of their child since Friday. What do you want to say to these parents?
Okay, so there's a few things that make things complicated right now for parents. One of them is the NACI guidance telling people to wait 2 to 3 months after an infection before getting their next dose. So there certainly could be some parents, because their child had a recent infection, where they postpone that second dose until 2 to 3 months after that infection. And that would be consistent with NACI's advice and certainly not a concern to us from a protection standpoint. But what we do feel concerned about is if people decide not to go with future vaccine doses because of an infection. Like I said, we have evidence that an Omicron infection by itself is not producing a sufficient antibody response against other variants. And we have the best data showing that the doses of the vaccine are protective. And so the same message that I have for adults is for children as well. We want you to be as protected as possible and to seek the best method to protect yourself or protect your child. And in most cases, that's your next dose of the vaccine, even if you've had a previous infection. So I would really encourage parents who might be canceling their appointments to rebook them for a few months in the future if their child has had a previous infection.
Thank you. Do you plan to reassign people who work at the super clinic at RBC? I mean by that, do you want to reassign them to maybe local action?
Yeah, we absolutely are looking at our human resources and where they're most effective and efficient. And so we do have teams who regularly assess where people would be needed, which clinics need to be open, which days, how many hours, and that is being adjusted as we go forward. I think we can expect that we'll continue to decrease the hours and the number of staff who are at some of the larger clinics. And those staff can be moved into other critical areas, either of the vaccine rollout or even other parts of the healthcare system. But for the best up-to-date information, I would recommend looking at the website, because we'll always have that information about which sites are open and what their hours are on the website, available for Manitobans.
From CBC Manitoba, Jill.
Good afternoon. I'm wondering what the plan is for vaccination cards going forward with restrictions lifting. Are you going to still issue them? Have those orders stopped? I'm just wondering, if they might still be going out, if they could be used down the line.
Yeah, so at this point, a final decision on that hasn't been made. There's a lot of complexities with that. People are going to still need the proof of vaccine for things like travel and other jurisdictions. So we'll have more information on that shortly.
And I'm wondering what the future of COVID surveillance is in Manitoba. Will you be reopening PCR testing, relying on wastewater monitoring? What's the future of surveillance look like?
Much like we've always done, we're going to have a multifaceted approach. So we still have a lot of PCR testing that's going to be done. PCR testing will still be completed in hospital and other high-risk settings. So that's where we really want to see our surveillance in those severe outcomes. Even though testing requirements will change likely related to travel, there's always going to be that random testing that's going to help us with surveillance as well. And you mentioned wastewater as well. So we have a multifaceted approach, which can be adjusted over time as necessary.
Thanks, everyone. This concludes our Zoom session.